Today I'll show you 5 game-changing AI tools to revolutionize your medical practice. I'm Mo, I'm a software engineer specializing in medical automation. I help doctors reduce burnout and frustration and save hundreds of hours a year using technology. Let's start with tool number 1, which is an AI medical scribe. If you're not already using an AI medical scribe, then setting one up should be your biggest priority. AI scribes listen to your patient interactions and generate your complete chart note for you without you needing to type a single thing. So let me show you an example. This is an AI scribe called Freed. So you can go to New Visit and then Capture Conversation up here. This is where you would have your conversation with a patient. It would transcribe that entire thing and then generate a simple SOAP note for that. So you can see here it has the subjective, objective, assessment, and plan, and you can immediately copy and paste these SOAP notes, or you can use some AI integrations which will paste those chart notes directly into your EMR. So I have a full guide about how to use Freed on my channel if you want to learn more about this one specifically. There are several others like Heidi AI. Another one is Deep Cura. Sully AI is another one that has even more advanced features, like a whole suite of AI assistants. But basically, they all have very similar functionality. They generate your chart note. All you have to do is review it for accuracy instead of writing it yourself, which saves most doctors at least 2, maybe upwards of 4 hours a day. Of course, you should do your own research on which AI tool you want to use. There's a great website called bestaiscribe.com where you can check out a list of dozens of AI scribes. You can click on anyone that you want and it will give you a list of its specific features, so you can check for yourself which one makes the most sense for your practice. But really, one thing that you'll want in any AI scribe that you're using is one that can integrate directly with your EMR and insert your chart notes for you, which will save even more time. So to give one example of that, this is what Freed AI looks like when it inserts your chart notes. So I'm here on the SOAP note page and I'll click on Freed and I have a patient and I'll just do push to EHR. This takes a couple of seconds and then it fills out this entire SOAP note. As you can see on the left side here, it filled in all of that information in the appropriate fields, which saves a ton of time. By the way, if this sort of thing is useful and you want me to personally help you eliminate hundreds of hours of frustrating charting a year, I run a program to help doctors do just that using AI automation. You can book a free call with me using the top link in the description below to start saving hours every week. But this brings us to the second AI tool, which is called Super Whisper. This is a very powerful dictation app. However, unlike the AI scribes that I just showed you, Super Whisper will work in any application on your computer, whether you're in your medical charts or writing an email or just in a notes app. So let me show you an example of this. I'll activate it with a keyboard shortcut, and then I'll say something and then press the shortcut again to end that dictation. Evaluate drug interactions for a patient taking ritonavir, rosuvastatin, and apixaban, considering CYP3A4 inhibition. And then I'll end that transcription. And as you can see, it pasted in and it got all of the medical terminology correct in this instance. And that's because I was using a Nova medical model, which is a certain type of AI model, which is trained on medical terminology like drugs and disease names. So this will be very accurate for physicians compared to a standard AI model that's not specifically trained for the medical field. Now, another very useful feature of Super Whisper is that you can add custom vocabulary if there are certain words or phrases that you frequently use that it may not be familiar with. And you can also have it expand certain phrases or replace them with other inputs. So let me give you an example of that. Like if you said my address, you could have it replace that with the address of your actual clinic. So maybe we say 123 Clinic Way as our address, and we can add a text replacement in. So now whenever we use Super Whisper and we say my address, it will replace it with our full address. So let me give you an example. Thank you for coming to my address. We hope to see you soon next time. And And as you can see, it says, thank you for coming to 123 Clinic Way. We hope to see you soon next time. So this is a great solution for quickly inserting text into any application. Super Whisper has a bunch of advanced features that I won't get into in this video, but it lets you do things like setting up custom templates, or even setting up offline AI models to keep everything HIPAA compliant. But now let's take a look at the third AI tool, which is called Open Evidence. This is an AI-powered medical search engine. It's free for licensed healthcare professionals. And let's use an example like this. I'm going to use Super Whisper to ask it a question. For meniscal tear of the knee, how do you order an MRI? Do you do it with contrast or without? So let's ask this question and submit this search query. Open Evidence will query a bunch of peer-reviewed medical journals and pull in the most relevant information. So as you can see here, it says an MRI for meniscal tear should be ordered without contrast. It will have the citations below to all of the relevant journal articles that it drew from in giving that answer. Many of them will be on PubMed. Some will link to the journal directly. So this is super useful for clinical decision support, but it can also do other things like writing patient handouts or even computing common formulas. So let me go to a new chat. And as you can see, if we do explore more capabilities, let's scroll down. There's a ton of things it can do. Let's search for handout, write a patient handout. And let's have it write a patient handout on managing type 2 diabetes and give this a few seconds to run. It will present it in a format where we can download it as a Word file, or we can just copy this directly and paste it into another place. But this is very helpful for saving time since you don't have to write any patient handouts yourself anymore. You can just ask Open Evidence to do it for you. Now, the next AI tool is called Doximity GPT. This is a HIPAA compliant version of GPT. You can ask it to do things like writing medical documentation or for things like clinical reference and decision support. But let me ask it a question which is a little bit complex, and let's see how it does. Please review the latest guidelines for managing type 2 diabetes, summarize the diagnosis criteria, key tests, key lab tests to monitor, and recommended treatment pathways. Present this info as a clear step-by-step clinical decision pathway with tables that compare medication options by efficacy, side effects, and contraindications. So this is a pretty complex query. Let's submit it and see how it does in coming up with a table with different medication options for type 2 diabetes. So it's generating a summary of what it looked up. And this one also has references to the relevant sources that it uses. But if we scroll down to the bottom of this response, then we can see it did indeed generate this table that we asked for with efficacy, side effects, and contraindications for a whole list of medications for type 2 diabetes, which is pretty incredible. All right, now let's turn to the fifth and final AI tool, which is Perplexity AI. This is a search engine which is better than Google. It allows us to query and it will grab a ton of different results and summarize them for us. So I'm going to say, again, using Super Whisper, I'll do, what are the benefits of using an AI medical scribe? So it will paste that in. We can submit this search, and this will grab a bunch of different sources across the internet and summarize the results for us. And again, we can see the sources here if we want to check anything ourselves. But this saves you the time that you have to spend on Google clicking on specific websites. This will just present the most relevant information to us. And it also gives very helpful related follow-up questions that we might want to ask below. So let's say, how do AI scribes integrate with common EHR systems? And then it will again pull a bunch of information and summarize it for us and tell us the most relevant information. So now that you know these 5 AI tools, check out this video next to save even more time in your practice. Thanks for watching.